Thank you, Mr. President. Mr. President, I come to the floor today to talk about an issue that is critical to patients and families in my home state of Washington and across the country. Today, parents are wondering if they will be able to get the health care that their kids need, and communities are wondering if they'll be able to provide it. That's unacceptable. Congress has to swiftly and fully restore the Children's Health Insurance Program, or CHIP, and funding for other services families need, like community health centers, which have been waiting now more than 100 days for a long-term solution. And they should do so without making deep cuts to successful prevention programs in the Centers for Disease Control that tackle avoidable conditions like heart disease and diabetes. Democrats have wanted to get this done for months, but by focusing on pushing through partisan tax reform at the end of the year, Republicans instead put massive corporations and the wealthiest ahead of making sure our children and their families have the health care they need. I really hope that now they are ready to give these issues their full and immediate attention, and in case they aren't, I want to make sure they know what exactly this is about. It is about children like Stella. Stella lives in Washington State. She is 5 years old. She has 2 brothers, a love of the outdoors. She likes swimming and kayaking, and she has a typical kindergartner's boundless energy and excitement. But Stella was born with spina bifida, an issue with how her spinal cord was formed. In just the past year of dealing with that condition, Stella's family went through 5 catheters a day, almost 2,000 in total. They went on 10 different occasions to have MRI scans. They went to get her new leg braces. And given the cost of all of that, they went through their $5,000 deductible in the first 5 weeks of the year. That's right, it just took 5 weeks. Additionally, this year, Stella is also scheduled now to have a bladder and kidney surgery. So as you can imagine, the expenses on this are really adding up, even with both of her parents working. Covering Stella's healthcare needs would be an unimaginable task. Fortunately, Stella does qualify for insurance through CHIP. CHIP has helped her family afford the treatment she needs, including physical therapy. Now, Stella's story is just one of many, many examples of families who rely on this program. There are 60,000 children in Washington State who are now insured through CHIP. 9 million families nationwide rely on it to help address the healthcare needs of their children. Yet Congress has taken over 102 days and counting to restore it. There is no excuse for this inaction. And families who rely on the CHIP program are not alone in needing our immediate attention. Thanks to CHIP and Medicaid, the uninsured rate among children is now at an all-time low. Jeopardizing that accomplishment by letting CHIP twist in the wind is simply unacceptable. This Republican-controlled Congress has also failed to renew other investments that our families rely on for the care they need. Programs like community health centers, which serve 25 million patients, particularly in our rural and poor communities. The National Health Service Corps, which brings doctors and other healthcare providers to underserved areas through scholarships and loan repayment. And the National Teaching Health Center Graduate Medical Education Program, which brings primary care and dental residencies to communities in need. Leaving these programs without long-term extensions a minute longer is utterly irresponsible because this lack of certainty for them is bringing a negative impact on our communities. For example, the Northeast Washington Health Program serves some of the most rural areas in my state, including Ferry County, which has fewer than 4 people per square mile. They are struggling now to hire needed medical staff and managers because of this uncertainty that's now there. Ferry County cannot wait. The Community Health Association of Spokane runs 12 health center sites and sees more than 70,000 patients a year. They recently began offering a very much needed opioid addiction treatment. If Congress does not reauthorize the community health center funding, those efforts will be jeopardized and expansions will be halted. So Spokane cannot wait. Yakima Neighborhood Health Services serves over 22,000 patients in 2016. Almost all of those patients were below 200% of the federal poverty line. If Congress does not act soon, 3 different clinics, including a clinic in one of the poorest cities in Washington, will be at risk. So Yakima cannot wait. I've heard additional stories of similar hardships from across my state. North Olympic Healthcare Network has had to put expansions for behavioral health care on hold. Another health center in Washington may have to reconsider building a new children's dental residency program. A center serving Whatcom County may have to cancel a project for medical, dental, and behavioral health care facilities as well. So across the country, there are a lot of examples for community health centers, just like the ones I mentioned, of healthcare that people of all ages and backgrounds rely on are being put in jeopardy, all because Republicans prioritize tax cuts for the top before the healthcare needs of millions of people at the end of last year. So it is far past time now to show these families we are willing to work, we are willing to get this done, and we need to give them the peace of mind that they can get the health care they need. They do deserve that. Thank you, Mr. President. I yield the floor.